Hi, welcome to Public Health. My name is Nichole Crick and I'm the nurse manager for Floyd County Health Department. You have a local health department in your county, and we have health departments in every county of Georgia. We serve our communities both inside our buildings and outside the building, and there are some things that you're probably very familiar with that we do and some things that you don't know, and we would just love to share with you what public health does in your community. We do everything from restaurant inspections in our environmental health to immunizations, which you're probably very familiar with, to emergency preparedness and lots in between. So let me take you on a tour, and I hope that you learn everything you ever needed to know about public health.
Bienvenido a nuestro Departamento de Salud.
We deal with clients of all ages, race, and ethnicity. You need to be able to open up to the client, but you need to have the client open up to you. That's extremely important in healthcare. And you need to not be judgmental of their attitudes, but provide information to them in a non-biased way. And you need to encourage them. We always try to make sure that our clients, we tell them, you know, if you're not doing this, that's okay, let's start it tomorrow. How can we help you? You know, what do you need to know? What questions do you have? So I think education and really being able to relate to the client is extremely important for any kind of a nurse practitioner in the healthcare setting today, but especially in public health.
Hi, welcome to immunizations. This is an area of public health you're probably very familiar with. You may have even gotten your shots here as a child. But we supply immunizations to our community, both private immunizations and state-supplied immunizations at a lower cost to our families to prevent disease. We do everything from seasonal flu vaccines to hepatitis B and A, and more recently in the last few years, HPV vaccine. But one of the things we do in immunizations every day prepares us for our emergency preparedness plans that we have in all of our communities. So for instance, back in 2009 when we had the H1N1 pandemic, we opened up pods so that we could immunize mass people in our communities at a quicker rate and get as many people in as possible, and that's part of emergency preparedness. So what we do here in our health department every day helps us prepare for events that may come, and we can make sure that we are an active participant in our communities and here to serve and support and keep our communities as healthy as possible.
Well, public health emergency preparedness, the biggest advancement is going to be going with making the communities aware of what's going on, not just with public health emergencies, but natural disasters, preparing yourself for those things. You know, having some medication supplies, having water supplies, food supplies, simple things. Telling them what we are responsible for doing in an emergency, helping them understand what EMAs are doing during a response. Also, we have our healthcare liaison section, which deals with the healthcare and hospital preparedness programs. We're working with private agencies like that, making sure that their plans coincide with our plans for emergencies and that they're able to respond and they're able to recover and mitigate after a disaster.
This would be an exam room if you came into your health department as a patient, and you may be seen to discuss family planning so that you can space your pregnancies apart. You may be seen so that we can talk to you and do some education around breast exams or male genital exams. We do STD exams and treatment as well as tuberculosis treatment. No matter what we're working with our patients on, our main goal is to educate and to prevent disease. So in adult health, we could have talked to you about pregnancies or STD prevention or breast and cervical cancer. Or you may be in this room for a child health visit. You may bring your children and we could be doing a well child physical, talking to you about developmental milestones, nutrition, and immunizations. Here in Vision Dental, getting ready for school, population health takes many forms. So our goal is to educate our community and to be an active participant in helping our community be as healthy as possible.
What we try to do in public health is we try to take care of the whole person, whereas in private practice, most places focus on one thing. Here,
from the time they walk in the door until they leave. We try to assess every aspect of their health and their family, and we try to treat or at least find a referral source for those patients to take care of all of their needs, so that we can help the community by taking care of as much as we can in our areas.
Another program you may be familiar with is our WIC program. That is our Women, Infant, and Children Nutritional Service Program.
One thing that I know how we impact our community in this area is the fact that when our parents come in and our moms come in, and they know what a hemoglobin level is, they know what their child's weight, where they lie on the scale, they know exactly where they're at, and some don't, but the ones that come in here and that we see regular, they know. And just as with my patients that I do follow that have struggled with weight gain and even overweight, and when I see changes and I see differences, I know that I've made a difference, and I know that not just me, that we've all down there made a difference in helping change their lives. This is a WIC nutritionist office. In our offices, we have the height board where we check a baby's height. We have the weight board where we check their weight for babies, infants 0 up to the age of 2 years old. We weigh on the infant scale and the infant board. And then when they turn 2, and then of course all women, we weigh on our adult scale, and then we do our adult height board. And then also we have, this is our hemoglobin machine. This is where after we stick their finger, we run their blood right here in that little machine, and it tells us what their hemoglobin level is. And this is where we assess our patients, counsel our patients, talk to them, listen to them. Everything's done right here in this office.
One thing unique about our health department that may not be in all health departments but is across public health in Georgia is our dental clinic. Our dental clinic actually serves all 10 counties in this area and region, and it's a state-of-the-art clinic. We provide services here at the health department that you would expect to see in a private general dentistry office. We see children and adults. Our dentist sees patients here, as I mentioned, from 10 surrounding counties, but he actually has students, dental students come in and see patients with him, and he mentors them, and we have so much to offer that we're very proud of our dental clinic.
There's a lot of different programs within public health that try to encourage people to promote health among themselves. Immunizations is a great one. There are still vaccine preventable illnesses out there. There are measles outbreaks, pertussis outbreaks, and by people taking the steps to prevent themselves from getting those illnesses, we create a healthier community. Also, for those that are too young to get certain vaccines, we can provide immunity among those close family members and household contacts around them to prevent illness as well.
Everything that we do has an impact on the community, whether it be inspecting a food service establishment to make sure that it meets sanitation requirements, or inspecting hotels and motels to ensure they're meeting sanitary requirements, ensuring that on-site sewage management systems are functioning properly, and rabies control, inspecting swimming pools to ensure that they're sanitary for people to swim in. All those programs that we do, the common goal is to ensure that people aren't exposed to viruses and bacteria.
Thank you for joining us. I've really enjoyed sharing with you what we do in public health. I hope you've learned about the different services we offer and the professionals that work to support your community every day.